This medication, Oseni, is used along with a proper diet and exercise program to control high blood sugar in people with type 2 diabetes. Proper control of diabetes can help prevent kidney damage, blindness, nerve problems, loss of limbs, and sexual function problems, as well as lessen the risk of a heart attack or stroke. Oseni contains two medications, Alogliptin and Pioglitazone. Alogliptin works by increasing levels of natural substances called incretins, which help to control blood sugar by increasing insulin release, especially after a meal, and by decreasing the amount of sugar your liver makes. Pioglitazone works by helping to restore your body's proper response to insulin. It is recommended to take Oseni as directed by your doctor, usually once daily with food. This medication is best taken at the same time each day to help maintain a consistent level in your body. Before taking Oseni, make sure to read the medication guide provided by your pharmacist. Take this medication by mouth as directed by your doctor, usually once daily with or without food. Do not split, break, or cut the tablet before taking it. The dosage is based on your medical condition and response to treatment. Take this medication regularly at the same time each day to get the most benefit from it. Follow your diabetes management plan, including medications, diet, and exercise. Check your blood sugar regularly and share the results with your doctor. If your blood sugar measurements are often too high or too low, your doctor may need to adjust your diabetes medication, exercise program, or diet. If you experience symptoms such as sore throat, muscle pain, or weight gain, it's important to let your doctor or pharmacist know. This medication has been prescribed because your doctor has determined that the benefits outweigh the risk of side effects. While many people using this medication do not experience serious side effects, it's important to notify your doctor if you have any new or worsening vision problems, bone fractures, reddish-colored urine, frequent or painful urination, joint pain, or unusual skin blisters. In some cases, low blood sugar may occur if this drug is prescribed with other diabetes medications. It's important to be aware of the symptoms of low blood sugar, such as sudden sweating, shaking, fast heartbeat, hunger, blurred vision, dizziness, or tingling hands/feet. It's also important to have a quick source of sugar on hand to treat low blood sugar, such as glucose tablets, gel, table sugar, honey, candy, fruit juice, or non-diet soda. Be sure to discuss with your doctor or pharmacist what to do if you miss a meal to help prevent low blood sugar. If you experience symptoms of high blood sugar, such as increased thirst or urination, it's important to notify your doctor right away. And while a serious allergic reaction to this drug is rare, it's important to seek medical help immediately if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing. If you experience any side effects not listed here, be sure to contact your doctor or pharmacist for further guidance. This medication, Oseni, may rarely cause or worsen a certain heart problem known as heart failure. It's important to be aware of the symptoms of heart failure, such as shortness of breath, swelling ankles/feet, unusual tiredness, and unusual/sudden weight gain. If you experience any of these symptoms, it's crucial to inform your doctor immediately. It's also important to note that this medication is not recommended for people with certain types of heart failure. Therefore, before using Oseni, it's essential to inform your doctor if you have heart failure. As for the daily dosage and optimal timing of taking Oseni, it's best to follow your doctor's instructions. They will provide you with the appropriate dosage and the best time to take this medication based on your individual needs and medical condition. Before taking Oseni, make sure to inform your doctor or pharmacist about any allergies you may have. This medication may contain inactive ingredients that can cause allergic reactions. It's important to discuss your medical history, especially if you have a history of bladder cancer, heart problems, kidney disease, liver problems, or certain eye and pancreas issues. When taking Oseni, you may experience blurred vision, dizziness, or drowsiness due to low or high blood sugar. It's important to avoid activities that require alertness or clear vision until you are sure you can do them safely. Limiting alcohol while taking Oseni is also recommended as it can increase the risk of low blood sugar. Stress on the body, such as due to fever, infection, injury, or surgery, may make it harder to control your blood sugar. Be sure to consult your doctor as this may require a change in your treatment plan. It's also important to inform your doctor or dentist about all the products you use before having surgery. Oseni may increase the risk of bone fracture, especially in women. It can also cause changes in a woman's menstrual cycle and increase the chance of pregnancy. If you are pregnant, discuss a plan with your doctor for managing your blood sugar. It's unknown if Oseni passes into breast milk, so consult your doctor before breastfeeding. Drug interactions can impact how well your medications work or increase the risk of serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Don't make any changes to your medication without consulting your doctor. There are certain medications that can affect how Oseni is removed from your body, which can impact its effectiveness. For example, gemfibrozil, rifamycins, like rifampin/rifabutin, and others can have this effect. Beta-blocker medications, such as metoprolol, propranolol, and glaucoma eye drops like timolol, may prevent the fast or pounding heartbeat that usually occurs when blood sugar falls too low. However, other symptoms of low blood sugar, like dizziness, hunger, or sweating, are not affected by these drugs. It's important to be aware that many drugs can affect your blood sugar levels, making it more challenging to control. Before making any changes to your medications, be sure to discuss the potential impact on your blood sugar with your doctor or pharmacist. Monitor your blood sugar as directed and share the results with your doctor. If you experience symptoms of high or low blood sugar, notify your doctor immediately. They may need to adjust your diabetes medication, exercise routine, or diet. If someone has taken too much Oseni and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call 911 or your local poison control center at 1-800-222-1222. In Canada, residents can call their provincial poison control center. When taking Oseni, it's important to attend a diabetes education program to learn how to manage your diabetes with medications, diet, exercise, and regular medical exams. You should also learn the symptoms of high and low blood sugar and how to treat low blood sugar. It's important to check your blood sugar regularly as directed. Before starting Oseni, it's important to have lab and or medical tests such as kidney/liver function, blood glucose, hemoglobin A1c, complete blood counts, and eye exams. These tests should also be done while you are taking Oseni. It's crucial to keep all medical and lab appointments and consult your doctor for more details. In addition, making lifestyle changes can help promote healthy bones. This includes increasing weight-bearing exercise, eating well-balanced meals containing adequate calcium and vitamin D, stopping smoking, and limiting alcohol. Consult your doctor about calcium/vitamin D supplements and to discuss lifestyle changes that might benefit you. If you forget to take a dose of Oseni, take it as soon as you remember. If it's close to your next dose, just skip the missed one and take the next dose at the usual time. Don't take a double dose to make up for the missed one. It's important to take Oseni at the same time each day for it to be most effective. The usual starting dose is 1 tablet once daily, taken with your first meal of the day. Your doctor may adjust your dose based on your individual needs. Always follow your doctor's instructions for taking Oseni. It's important to store Oseni at room temperature, away from light and moisture, but not in the bathroom. Keep it out of reach of children and pets. When it's expired or no longer needed, make sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on the best way to do this. Remember not to flush it down the toilet or pour it into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.